Okay, so my project is going to be over smoking and tobacco cessation. So I'm gonna just show you some examples of several types of cigars, cigarettes, and e-cigarettes and things like that. Um, so, for example, smokeless tobacco, we have the chew, the dip, and those are 37 times more likely to develop a precancerous mouth sore than non-tobacco users. It's also one of the major cause of oral cancer, which kills 8,000 people each year, and other risk factors for oral disease. It can cause gum disease, decay, tooth loss, and leukoplakia, which are thick white patches in the oral mucosa. Also contains at least 28 cancer-causing chemicals. Another one is the e-cigarettes, vaping, or juul. So the nicotine reduced flow to the gum tissues, which can cause recession, increase of cavity risk, sensitivity, possible tooth loss, and also is linked to cardiovascular disease, chronic lung disease, and asthma. And e-cigarettes are so dangerous. It contains volatile organic compounds, ultrafine particles that can be inhaled deep in the lungs. Also, heavy metals such as nickel, tin, and lead, and also other causing cancer-causing chemicals. Cigars and cigarillos. We know that cigar smokers are 4 to 10 times more likely to die from oral and throat cancers than non-smokers. One large cigar contains the same amount of tobacco as a pack of cigarettes, so that's very potent. Responsible also for thousands of premature deaths among adults of the age of 35, and also it triples the risk of developing gum disease as well, which can cause tooth loss. Cigarettes compounds, as you can see, it has a bunch of cancerogenic components such as butane, carbon monoxide, arsenic, and someone who dies every 4.5 seconds from tobacco related disease. So one cigarette takes 11 minutes off of your life, and mostly of the smokers, they die 10 years earlier than the non-smokers, and kills 480 Americans every year. So you're basically inhaling toxic into your body. We have the hookah or water pipes, and those are pretty powerful. They are about 100. It's equal to 100 cigarettes. So if you can imagine that. So hookah tobacco and smoke contain many toxic agents. And heart disease. Babies born to people who smoke water pipes every day while pregnant weigh less at birth, so at least 3 ounces less than babies born to those who do not smoke. The charcoal used to heat the tobacco can raise health risk by producing high levels of carbon monoxide, metals, and cancer-causing chemicals. Hookah tobacco also, when you smoke, several toxic agents known to cause lung, bladder, and oral cancers as well. And marijuana. Here are just some effects of marijuana that can cause in the brain. It can cause several different parts of the brain, including those responsible for memory, learning, coordination, and sensory and time of perception. For example, in the hypothalamus, it can increase appetite. That's why when people are ingesting and smoking marijuana, they have the moochies, they have the desire to eat more. And also the ventral is stratum, and it causes euphoria and relaxation. The amygdala increased and anxiety and paranoia. The neocortex altered sense and disorder thinking, and hippocampus it can cause impaired learning, and the cerebellum increase motor control. Pipe tobacco. So cigar and pipe smoke, they double the risk of the airway damage that leads to chronic obstructive pulmonary disease, the COPD. Smoking can cause worsened asthma and heart disease, also, and increase the likelihood of having a heart attack or a stroke. Those are some more diseases related to smoking. We talked about heart disease. So the coronary artery disease, the chemicals in the cigarette smoke can cause the thicken and the form a clot inside of the veins and arteries. And the blockage from a clot, they can lead to heart attack and sudden death. Stroke, secondhand. So if you don't smoke and somebody smokes next to you, you are 20 to 30% more likely at risk for a stroke. Each year, secondhand smoke exposure causes more than 8,000 deaths from smoke. Breathing secondhand smoke interfere with the normal functioning of the heart, blood, and vascular systems in ways that increase the risk of having a heart attack. And as you can see in the picture right there, the plaque that builds up in the carotid arteries. And lung disease, as you can see the picture, we have a healthy lung. It's pink, it's pretty clean. Comparing to the cigarette smoker, you see that's pretty dark. And the marijuana smoker is even worse. So in lung cancers, it causes more death than colon cancers, breast and prostate cancers combined. So this is it's very dangerous. And worldwide, lung cancers cause more cancer deaths than any other malignant disease. And the main cause of lung cancer, we know that's smoking. And chronic bronchitis is the number one risk factor for developing chronic bronchitis if you smoke cigarettes. Over 90% of patients with chronic bronchitis have a smoking history. Also, only 15% of the cigarette smokers are ultimately diagnosed with some type of COPD. And infertility is one of the main causes of infertility. Smoke is. So women who smoke do not conceive as efficiently as non-smokers. Infertility rates in both male and female smokers are about twice the rate of infertility found in smokers and non-smokers. And the risk for fertility problems increase with the number of cigarettes smoked daily. And also erectile dysfunction, it's also one of the side effects for smoking. This because it damaged the blood vessels, and it results in poor arterial blood supply to the penis. And emphysema is another type of lung problems that's caused by smoking. And here's just an example. We have the healthy alveoli, and then when we smoke, harmful particles trapped in the alveoli, then what causes inflammation. So inflammatory response triggered those due to the harmful particles. And then the inflammation chemicals dissolve the alveolar septum, and then the large air cavity line with carbon deposit formed. And that's why it becomes so dark, because those alveoli, they basically consumed all those smoking inside. And then what are secondhand and third-hand smoking vape aerosol? I kind of mentioned in the other slide a little bit. What is secondhand? So it's basically, it comes from secondhand smoke, and vape aerosols come from burning or heating tobacco through a cigar, pipe, hookah, and e-cigarettes. They also come from the air as smoke exhales while smoking. And a third-hand smoke is the smoke that stays in the carpet, walls, furniture, curtains, clothing, hair, toys, and etc. So if you have little ones, you need to be careful not to smoke inside of the house, because they can get the third hand smoke. And here are just some psychological addiction that's caused when you smoke, especially, with the nicotine. So basically, the nicotine is delivered by smoking and it can travel to the brain, and the nicotine activates receptors like stimulation receptors, such as dopamine. And what happens, this dopamine is released, and it leads to pleasant feelings and calmness and reward. So dopamine levels reduced, leading to withdrawal symptoms of stress and anxiety. So that's why you have the urge to smoke again, because those feelings are gone after a while, after smoking for a little while. And the withdrawal triggers desire for another cigarette. And are you interested in quitting? So, in United States, we have wonderful programs that can help people to quit smoking. And here in Wyoming, we have Wyoming Quit Tobacco, and we have the the national number, which is 1-800 quit now. Or you can have a specific one, that's you can go to the website Wyoming Quit Tobacco, and you can see the 307 number you can call for more specific assistance. And those programs are pretty cool because they are free, and they offer therapy. They can give you free nicotine replacement therapy, such as patches, gums, and inhalers. And also, they can help you with prescription medication at low cost, such as the bupropion, the Wellbutrin, and the varenicline. I'm not really how to say that word, but anyways, they can help you with those medications that will help you to quit smoking. And here's just some advanced safer alternative to nicotine. There's like a 5-minute cigarette craving boosters. You can eat a pickle, chew a gum, drink a glass of water, floss and brush your teeth, do 3 sets of 10 jumping jacks, suck on a piece of tart candy, or whistle or hum for a while. That can help a little bit with the cravings. And what's your motivation to quit? We can educate our patients what is the motivation for them to live longer, because we know if they quit smoking, they will be able to live longer and stay to enjoy more the loved ones. And some people, their motivation is the friend, or it's the family, or the health, to have a better health in general. And here's a little bit of what happens during the process. There are these 5 A's of smoke cessation that we can approach to our clients. It's ask, advise, assess, assist, and arrange. So ask about tobacco use to your client. Advise tobacco users to quit. Assess readiness to make a quit attempt. Assessed with a quit attempt, and we can arrange the follow-up care for those patients. And on these post here, there are some benefits that happens when you quit smoking. For example, in 24 hours, the chance of heart attack decreases. In 72 hours, the bronchial tubes relax. In 48 hours, a sense of smell and taste improve. Nerve endings start to regrow, and things like that. Here are just like a little bit of the stage of changing, like change of the smoke sensation. So pre-contemplation are those that are not quite ready yet to quit. So they're probably thinking in the next 6 months. The contemplation, they're starting to get there, and but they have not made a decision to quit for the past year. And then the preparation, those are the current smoker who are definitely planning to quit within the next 30 days. And then action, those are individuals who are not currently smoking and they have stopped smoking with the past 6 months. And then maintenance, those are individuals that continually not smoking for 6 months, smoking for longer than 6 months, but less than 5 years. So those are a little bit of the stages that they go through. And these are my reference. Thank you.